Assalamualaikum sir. Walaikum salam sir. Welcome sir. Thank you for joining sir. अच्छा, मैं आपको दोबारा देखता हूँ. दो तो हो गए, क्या करें? टाइटल वीडियो स्टार्ट कर दें? सर टाइटल वीडियो स्टार्ट कर दें?
टाइम पे स्टार्ट करें. लेट्स स्टार्ट.
ओके सर.
व्हाट्सएप आए.
Some journeys aren't defined by a destination, but by their transformation. From passionate beginnings to defining milestones, the Pakistan Cardiac Super League became the heartbeat of academic excellence. Two pioneers joined forces once again to ignite the spirit of learning and leadership. What began as a challenge became a movement. In every round, a new hero emerged. In every team, a story was written. Now, the legacy continues as 16 elite teams step into the arena to prove their strength, their skill, and their synergy. Team LNH Pelicans, Team SGTH Tigers, Team BVH Cardinals, Team FIC Fighters, Team SICVD Thunders, Team AFIC Lions, Team PIC Hawks, Team Dow Dolphins, Team NICVD, Team RIC Dreadnoughts, Team LUMHS Falcons, Team MIC Panthers, Team AQH Stars, Team BMC Strikers, Team HMC Stallions, Team PIC Warriors. Guided by the visionary stakeholders of the Pakistan Cardiac Society, steered by the Governing Council, the backbone of PCSL. Judged with fairness and integrity by our panel of expert umpires, and held together by the voice of reason and brilliance, Dr. 𝐏𝐚𝐤𝐢𝐬𝐭𝐚𝐬, our moderator, whose pivotal presence made this league a resounding success. Glory goes beyond borders. The winning team will earn a prestigious opportunity to participate in an international cardiology event. Mark your calendars, the battle for brilliance begins August 9th. Pakistan Cardiac Super League, Season 3, the ultimate test of knowledge. Powered by Wilson's Pharmaceuticals,
Assalamu alaikum and welcome. I am 𝐏𝐚𝐤𝐬𝐭𝐚𝐧 𝐂𝐚𝐜. It's an honor and privilege for me to be here with you as we gear up for the third match of Pakistan Cardiac Super League Season 3, which is going to be played between two teams from Group C, NICVD Kings and LUMHS Falcons. This event, as always, is proudly hosted in collaboration with Pakistan Cardiac Society and is powered by Wilson's Pharmaceuticals. Before we dive into the match, I would like to extend my welcome to esteemed council members and umpires of Pakistan Cardiac Super League who have graced us today with their presence. We have with us Professor Mohammad Ishaq Saab, the match umpire, Professor Abdul Siddiqui Saab, Professor Amber Ashraf Sahiba, Professor Sohail Ibrar Saab. Last but not the least, I would like to introduce the moderator of today's program. He is not only a seasoned cardiologist, stroke interventionist, and above all, a dynamic and passionate moderator, Dr. Hamza Azhar Ghori. So over to Dr. Hamza Ghori Saab to officially start the proceeding of today's match.
Thank you very much, Hamza. So, we are back again. And I would like to take this opportunity to welcome you all to this amazing third season of Pakistan Cardiac Super League, which is brought to you, of course, by Wilson's Pharmaceutical in collaboration with Pakistan Cardiac Society. So it's going to be a battle between the two teams. Both the teams are rising from the province of Sindh. We have NICVD Kings from Karachi and we have LUMHS Falcons from Hyderabad. And I know it's going to be a tough fight. Every match is a knockout game. So best of luck to both the teams. And like always, hopefully, we are looking at a very high scoring game, inshallah. With this, I would like to take the opportunity to welcome our esteemed umpires and at the same time our faculty members. So I'm going to start with our biggest showstopper that we have got. It is our umpire of the match, and for many seasons and many matches we have had Professor Mohammad Ishaq Saab. Welcome, sir. We are also supposed to have Professor Abdul Hamid Siddiqui as the second umpire. Hopefully, I think we'll have him during the course of the game. And amongst our faculty members, we will be having Professor Fawad Farooq Saab. Oh, it's always great to have him. He instills so much of encouragement for everyone in this show. Another of our faculty members, Professor Amber Ashraf Sahiba, hopefully she'll be there to guide us, and we'll have Professor Sohail Ibrar Khan Saab. It's going to be great when they're all here, and we'll have the introductions as we move on. So, with this, we have the two teams. So, can I have any of the two teams on the screen, please? Randomly, if we can have our LUMHS Falcons, can I have them on the screen, please? Or we can have NICVD Kings, because I'm going to ask randomly any of the teams. I think we have LUMHS on the screen and the captain to start with the introduction of the team members. Go ahead, please. You'll have to unmute. You will have to unmute. Okay. Can you hear me? Falcons. But we can't hear you. You will have to unmute. Okay, the technical team, can you help them, please? Yeah. Okay, we can hear you now. Walaikum assalam. Captain, start with the introduction, please.
I'm Dr. Anam Bhutto. Can you hear?
We can hear you. Please go ahead. We can hear you.
Hello.
Yeah.
Assalamu alaikum.
Walaikum assalam. We can hear you clearly.
Hello. Assalamu alaikum.
Walaikum assalam. Okay, technical team, I think they are unable to hear us. Falcons, can you hear me? You cannot hear me. Can you hear me?
Yes, yes.
Okay, so is this okay? Now we have NICVD Kings on the screen, right? Okay, please start with the introduction.
I'm Dr. Farhan, and on my right hand, this is Dr. and on extreme left there is
Okay, so are you ready for the game?
yes.
Okay, that's good, but I still believe the volume is pretty low. Technical team, if you can help us with that. So, Kings, best of luck to you, and we are going to start the match very soon, hopefully. So, can I have Falcons on the screen now? LUMHS Falcons. Okay, but I still cannot hear you. You will have to unmute yourself. Can you hear me? Can you hear me? Okay, they can hear me, but we can't hear them for some odd reason.
Can you hear now?
Yes, we can hear you now.
I'm Dr. 𝐏𝐚𝐤𝐬𝐭𝐚𝐧 resident cardiologist, R3, and together here is my team.
Myself, Dr. Rahman, cardiology resident, R3.
So my name is Dr. Mohammad Awais, resident cardiology, R2.
I'm Dr. Shafiq, R4 resident.
All right, so welcome to the show, welcome to the match, and best of luck to you. And we are hoping for a wonderful game today and a tough fight. So as we move on, we'll talk about the conditions. I think the sun is shining bright, the pitch looks good, and I'm hoping for a high scoring game. But then again, you never know how it goes. So with this, I'm going to move to the next segment, that is going to be the toss of coin, and it's going to be an electronically done coin toss. Can we have it on the screen, please? And I'm going to randomly ask one of the teams to either pick head or tail. All right, so I think can I have LUMHS on the screen? LUMHS, can I have them on the screen? Hyderabad, LUMHS, Falcons, what do you want? Heads or tails? Heads. Okay, roll the coin, please. Let's see. They've asked for heads. And it's a tail. Okay. Never mind, it's just a coin toss. It can go either ways. All right, so the news is that it is NICVD Kings who have actually won the toss. All right, NICVD Kings. A great start, right? Okay, so I'm going to pose you with two questions, as you know the format of the game. The first question is whether you want to throw the questions or you want to take the questions.
We'll throw the question.
You want to throw the questions. All right. Yes. And the second question is, you have two scenarios, two cases in front of you, A and B. Which one do you want to pick? Can we have it on the screen? Yes. Pick one.
For throwing the question or for?
For throwing the question.
We'll choose A.
All right. So here it is. The news from the center is that NICVD Kings have won the toss. And they have decided to throw the questions, and they have selected scenario case A. All right. With this, I'll now seek the permission from our umpires to start the game. Sir, can we start?
Yes, please go ahead.
All right. Here we have the blessings from our seniors, our faculty members. Professor Ishaq Saab is there, and the umpire has asked us to start the match. Okay, bring it on then. Can we have the case scenario on the screen? NICVD Kings, throw it.
We have a 72-year-old male, retired executive, with a complex medical history including CKD stage 3, COPD, non-ischemic cardiomyopathy, with an ejection fraction of 30% and a history of recurrent admission for acute decompensated heart failure. Presents to the emergency department, he reports a 3-day history of progressively worsening shortness of breath, orthopnea, proximal nocturnal dyspnea, now accompanied by a persistent cough product of pink through the sputum. He denies chest pain or fever. His medication includes sacubitril valsartan, furosemide, metoprolol succinate, dapagliflozin. He himself manages his fluid intake and has been adherent to medication regime. On examination, he appears distressed, using accessory muscle for respiration. His blood pressure is 83/52. Heart rate is 115 beats per minute. Beats per minute, irregular. and the respiratory rate is 36 breath per minute, and oxygen saturation is 86% on room air. JVP is elevated to 15 centimeter of water. Cardiac auscultation reveal S3 gallop and bilateral crepitations extending to the mid zones. Abdominal examination reveals a tender hepatomegaly. ECG shows AFib with rapid ventricular response. Initial lab results show HB of 10.5, transferrin saturation of 15%, elevated creatinine of 2.8 milligram per deciliter, and burn of 60 mg per dl, and a BNP of 3,500 picogram per ml.
All right, LUMHS Falcons, I know it's an exhausting scenario. I'll give you a couple of seconds to gather yourselves. Let me know when you're ready. And I will also request the team which is reading out the scenario to keep themselves, or when they are answering, to keep themselves unmuted. Everybody else should be muted at that time, otherwise we hear a lot of distortion.
फास्ट वेंटिकुलर रेट है.
All right, Falcons, can we start with the first question? Are you ready?
Yes, ready.
Okay, they seem to be ready. Roll out the first question. Kings, read it. You'll have to unmute, Kings.
For his current acute unmuted.
Okay,
unmuted.
start please.
Given the patient's presentation medical history, what is the most likely precipitating factor for his current acute decompensated heart failure exacerbation despite medical adherence? A, acute myocardial infarction. B is infection like pneumonia, worsening chronic kidney disease, atrial fibrillation with rapid ventricular response, and E is non-adherence to dietary sodium restriction.
Falcons, you have 60 seconds to answer. Your time starts now. And the answering team should keep themselves unmuted. We want to hear the discussion.
infection
20 seconds are left. Come on, Falcons. We want to see a big 6. Yes.
D delta.
D, delta. Are you sure about it?
Yes.
You want me to lock it?
Lock it.
Okay, she's saying lock it. She's very confident. All right then, lock D delta. And yes, the confidence is right. And so is the team. Great flick for a 6, and this one is flying over the boundary, over the square leg boundary for a 6. Beautiful start. Well done. That's what we want to see. All right. Question number 2 on your screen now.
What is the most appropriate next step for this patient? A is immediate initiation of intravenous inotropes, and B is high dose intravenous loop diuretics, C is defibrillation, D is cardioversion, and E is IV amidone.
Timer starts now.
Patient's coming up. Taking 88 biopsy.
Approaching 20 seconds.
Again, D delta.
Are you sure you want me to lock it? D delta.
Yes. Yes, lock it.
Okay, so they are saying let's lock D delta. As sure as they are, let's see what happens. Lock it. And once again they're right. It's paying off well. They're taking their time. I know Ishaq Saab is happy because they are not hasting it into a wrong answer. They're taking their time, playing it sensibly and hitting it for a wonderful 6 again. Well done. Great start. So you're in for a hat trick. Let's see what happens in this third question, which is on your screen. Question number 3.
In which of the following condition cardioversion is contraindicated? A is acute multifocal atrial tachycardia. B is catecholamine-induced tachycardia. C is atrial fibrillation. D both A and B. E is none of above.
And the time starts now, please.
हाँ देखो मैं तो कंफर्म
कैटेकोलामाइन्स में देखिए साइनस ही होगा ना, तो साइनस करते हैं।
रिफ्लेक्स टेक होता है ना
हाँ
रिफ्लेक्स टेक
तो साइनस ही होगा ना वहाँ पे रिचनेस मींस तो मतलब एक फिर में तो करेंगे नन ऑफ द अबव बन ही नहीं रहा किसी भी सेंस में
ए फिर में तो वैसे ही कर तो ड्रॉप लेके हमारे पास ए और बी रहेगी
डी
25 seconds. Come on.
डी डेल्टा
Oh my
D
God.
delta?
D delta. You want me to log D delta again?
यस रॉकेट
Lock D delta. Okay.
Yes.
Again, what an answer. Well done. D delta is the right answer again. So it's a hat trick of D deltas and it's a hat trick of 6s by Falcons. Well done. My goodness. Now even I am, pretty excited to see the next one. Is that D delta as well? Let's see. Because at the moment it's Falcons and it's D deltas. Great going. But they are confident. They know their answers. Well done. Indeed. All right. Question number 4 on your screen now.
Patient's ABG shows pH of 7.15, PCO2 of 54, PO2 of 78, and by carb of 16. What should be the treatment plan to cater his respiratory distress? A is uprighted supplemental oxygen via face mask. B is BiPAP, C is CPAP, and D is mechanical ventilation, and E is trial of CPAP followed by mechanical ventilation.
And the timer starts now. 60 seconds on your screen.
रेस्पिरेटरी
फाइव की तरफ ही जाएगा सोच लो एक दफा
ऑक्सीजन तो आउट हो गई क्योंकि मैकेनिकल वेंटिलेशन नहीं बनता
ऑक्सीजन बहुत ज्यादा कम नहीं है 78
78 है लेकिन 54 का PCO2 है
तो टाइप 2 रेस्पिरेटरी है और CO2 को कम करेंगे तो बाईपैप भी
एग्जैक्टली
वो शॉर्ट करनी है ना बाइक सही
बी बीटा
Okay. You want me to lock B beta this time?
यस
No deltas this time?
नो
Okay. They want us to lock B beta. Lock it. Oh my goodness. That's the first blemish, the first mistake. And never mind, you've already hit 3 in a row and you still have 6 more to go. All right. Question number 5 on your screen.
For this patient, what would be the initial tidal volume you would like to set? A is 10 ml per kg ideal body weight, 12 ml per kg ideal body weight, 14 ml per kg ideal body weight, C is 16 ml ideal body weight, and 18 ml per kg ideal body weight.
60 seconds on your screen. I think the ball has started moving a bit. Let's see how they negotiate.
10 कर सकते हैं ये ज्यादा नहीं हो जाएगा
Watchful.
डबल हो जाएगा
लेकिन मैकेनिकल वेंटिलेशन पे है ना
हाँ मैकेनिकल
Ten,
बाकी सारे ऑप्शंस बहुत ज्यादा हैं पर केजी वेंटिलेशन की नीड नहीं है 10 कर दूं
25 seconds.
कर दूं ए अल्फा
A alpha. Are you sure about it? You want me to lock A alpha?
यस लॉक ए अल्फा
You're guessing, right? Or you're sure about it?
यस नो यस
It's a guess. All right. So they are guessing. They're trying to swing at it. Let's see where it goes. Lock A alpha. And that's the right answer. Well done. Very well done indeed. I think that one got the top edge and went out of the boundary for a huge 6. Well done, well played. As they say, luck favors the brave. So they were still trying to figure out, and this is where the teamwork comes into play, and at times you can even come up with the right guess. So well done, well played. That keeps you on course. You're heading for a good score. We have had 5 questions. You've correctly answered 4 of them. Just 1 miss so far. Okay, bring question number 6 on the screen.
A 2D echo is performed. Which of the following parameter doesn't predict prognosis in this case? A is EF, B is LVOT-VTI, T is TI index, and D is mitral valve deceleration time of 110 millisecond, and E is E to A ratio is of 1.9.
Your 60 seconds start now.
देखो ए भी है ई टू ई प्राइम भी है और ये रेट ये डायस्टोलिक
E to A ratio.
ई टू ए रेशियो ना
ये रेशियो है
हाँ तो वही है और ये
डिसलेक्शन हम एक में चला है तो वो इंपॉर्टेंस है.
डी और ई दोनों डायस्टोलिक डिसफंक्शन को देख रहे होते हैं टाई इंडेक्स और ईएफ वो भी है तो एलवीओटी वीटीआई नहीं है
Which VTS profiling के लिए होता है medication.
इसके लिए प्रोग्नोसिस के लिए देखो प्रोग्नोसिस के लिए हमारे पास ये है एलवीओटी वीटीआई मुझे नहीं है नहीं है तो
25 seconds left.
ये रेशियो
ई टू ए रेशियो वो है ना डायस्टोलिक डिसफंक्शन के लिए होता है वो तो है प्रोग्नोसिस के लिए काम आता है और ये भी
15 seconds.
प्रोग्नोसिस में नहीं
10 seconds. Come on. Answer.
बी
D. D or B?
बी बीटा
B
B
beta.
beta.
Okay, they want me to lock B beta. And let's see, because there was a lot of discussion going on. We are all at the edge of our seats. Let's see. B beta, lock it. Oh, that's a miss. All right. So they were trying to make sense out of it. It was a difficult delivery coming into them and straight onto the pads, and they were caught in front. All right. Question number 7 coming your way.
Which of the following electrolyte abnormalities are you most concerned about developing with aggressive diuretic therapy? Hypokalemia, hypernatremia, hypercalcemia, hypomagnesemia, and hyperglycemia.
60 seconds on your screen.
हाइपोलेक्सिया होता है लेकिन हाइपर नहीं होता.
हाइपर नहीं होता ए अल्फा
Well, this time they've come down the wicket and they're trying to heave it for a straight drive. Are you sure? You want me to lock it?
यस लॉक इट
Okay, they are saying lock it. Very confident. Lock A alpha. And they're rightly confident. Very well done. Wonderful hit. That's a big one. Great going. All right, so we are moving towards a pretty decent total, 30 on the board. That is, and we still have 3 more questions to go. Very important 3 questions, I'm telling you. Okay, question 8 on your screen.
A nephrology team also reviews the patient on an account of his CKD, and options of possible hemodialysis with ultrafiltration is considered. Which of the following trials evaluated the role of ultrafiltration in this setting? A is CARE-HF, B is CARES-HF, and C is CANVAS-HF, D is CARE-HD, and E is CARE-HD.
And the timer starts now. 60 seconds.
अल्ट्राफिल्ट्रेशन अल्ट्राफिल्ट्रेशन
देखो बाकी ट्रायल्स के तो नाम नहीं होना
केआरएस एचडी भी है
ए और बी में वो है पर ये 3 तो नहीं हो सकते
केयर एचएफ में रिसेंटली
केयर एचएफ
सीकेडी का
क्या करना
ये उसमें और
केयर एचएफ
कंसर्न
ए
ए एल
ओके ए अल्फा A alpha.
Okay, so you want me to lock A alpha. Are you sure?
Yes.
She's saying lock. I am sure. Lock A alpha then. Oh, this time the ball was moving the other way. Oh, another miss. Okay, you were close, but that one whiskered past the outside edge and it was missed. Okay, moving to the second last question of this innings. Question number 9.
How would you like to manage this patient's iron deficiency? Oral iron, IV iron, blood transfusion, oral iron plus erythropoietin, is IV iron plus erythropoietin.
60 seconds are all yours. Make the most of it.
तो erythropoietin मतलब
या तो IV हो सकता है या oral हो सकता
CKD है ना erythropoietin तो देंगे ना
है oral जैसे
लेकिन इसका टेल इतना ज्यादा अगर 8 मतलब फिर भाई
A alpha.
Okay, A alpha. Are you sure?
Yes.
Okay, she's always sure and this time seems to be more sure. Okay, lock A alpha. Let's see. Oh, that's another miss. Okay, okay. Never mind, never mind. You have played very well indeed and you still have one more question, the last one for your innings. It's an extremely important question because I think that's going to take you to 36, which would still be quite competitive, I tell you. Okay, can we have question number 10 on the screen, please?
Which of the following trials show benefit of iron on acute heart failure? A is fair HF, B fair HF2, firm HF, red HF, and none of above.
60 seconds, come on.
fair है
एयर हो सकता है बाकी रेट का क्या है रेट में क्या हीमोग्लोबिन से ये हो सकता है एयर कम्युनिटी
क्या करें?
POD में वो है
क्या करें?
कभी पता है नहीं पता
fair है
लेकिन वो मुझे आयरन के साथ नहीं लग रहा।
रेट करें
क्या करें?
25 seconds.
रेट सेल कुछ हो सकता है तो डी करते हैं
क्या करें?
डी करें
red है
रेड एच
15 seconds. 10 seconds. It's an in-swinging Yorker. Are they going to paddle sweep it? 5 seconds.
डेल्टा D
Delta. D delta. You want me to lock D delta, right?
Yes.
D delta. Lock it. And it's the wrong answer. Oh. All right, all right. So with this, I think we've come to the end of this first innings and the score is 30. I think you had a wonderful start, but in the end you lost your way a bit and this gives us a meager, mediocre score of 30. But we've seen funny things in this game. Even a low score at times can become a difficult one to handle. Well, now the Kings will be gearing up for their innings up next. But before that, I think we are going to take the experts on board and we have our umpire first of all, Professor Ishaq Saab. Sir, your thoughts please.
Thank you very much, Hamza. I think it was a good match, but the score is quite modest given our previous matches. But anyhow, they have to fight the other team. Let's see how they perform. As I said earlier, they have to take their time to think carefully before they answer. And I think they found it a bit difficult, and that's why score is not great. But that's, as you say, there's always surprises in the game, and maybe the other team doesn't match this score. But I think I would like the other team to have a higher score because 30 is a very modest score by any standards. So I think they need to work hard and improve themselves, and they should realize their faults and mistakes that they have made. So, as we say, this is learning experience, not to make one victorious, the other defeat, but it's a learning experience that they should get provoked and they should get a stimulus from this exercise and improve themselves. Thank you.
Thank you very much, sir, for your thoughts and your guidance as always. It's always great to have Professor Ishaq Saab, and he's leading the way and guiding the team. So the competition is always there. One team wins and the other loses, but then the important thing is to make the most of what you have and take home the wealth of knowledge. It's a learning curve for everyone, and I'm sure you will learn a lot from this. So the game is still not over. It's open for both the teams, and we do have Professor Amber Ashraf with us. Ma'am, welcome to the game. What are your thoughts today?
Assalamu alaikum, Hamza. Nice to hear from you, and especially from Professor Dr. Ishaq Saab. And I always appreciate the energy and the dedication of Professor Ishaq, due to which all of us are learning day by day, and he's really a motivational figure for all of us. Salute to you, sir, before I'm appreciating the rest of the teams. For these teams, that's really a learning opportunity, and they should understand how to go and prepare themselves for MCQs. That's a different type of the learning style in which one have to develop themselves to read that STEM and to analyze the answers as quickly as possible so that they can come up with the right answer. But anyhow, as you have just informed us, and Professor Ishaq Saab, the score is not up to the mark, but anyhow, it's a part of life. And just think, from the second team, we are going to learn more concepts and more things, and that is the beauty of these matches. Keep it up, G, and good luck to both the teams. Let's see how they are going to take it. Thank you very much, Dr. Hamza. Thank you.
Thank you very much, ma'am. So I think some very important aspects touched there. It's the technique of going through these MCQs, and the idea is to teach each other how to go about it. And whenever you see any Vinay or any scenario in any exam or in a quiz program like this, it's always smart to go through the important aspects of that case scenario and then link it with the question. And you need to decipher the code at the same time. Before that, you have to filter the information, get to the right information, and then when you pick the right things, put the pieces together, you know what you're heading for. But obviously, your preparation, your knowledge is going to help you in that, and there are different techniques that can be utilized. So I still think it's very much open for both the teams. Never lose heart till the last delivery is bowled. And I do see another star, and that is Professor Fawad Farooq. I saw him there. Sir, are you there?
Yes, Hamza, I am there just to witness. Just continue with your proceedings.
Yes, sir. We've just had, it's the break in between. We've just had one innings, and it was our LUMHS Falcons who've put up a score of 30 and 30. So it's a mediocre score, half and half. And Kings are going to start. NICVD Kings are going to start with their innings. So should we proceed then?
Yes, I think.
Okay, so here we go. Can we have the second scenario, the second innings on the screen now? Okay, and I'm going to request Falcons to read the scenario, please.
A 70-year-old lady, known diabetic and hypertensive, presents to emergency department in collapsed state. On examination, she is pulseless and has no recordable blood pressure. CPR is started as per ACLS protocol, and patient is intubated.
Okay, so I'm going to give you a couple of seconds. Kings, let me know when you're ready. Okay, should we start with the first question? Kings, should we start?
Yes.
Okay, read the first question, Falcons.
The nurse tries to secure an IV access via peripheral vein, but she is unable to do so. What should be the next step to secure IV access?
Read the options also.
A. Attempt A. Attempt to get access via peripheral vein again. B. Pass a CVP line. C. Secure an intraosseous line. D. Focus on chest compressions. IV access can be attempted later on. ROSC is achieved. And E. None of the above.
Your 60 seconds are on your screen. Let's see how they start. Because Falcons started really well, and I would request NICVD Kings to keep themselves unmuted. We want to hear your discussion, please.
C. See, we are going with C. Charlie.
You have time. Don't be hustled into it. Are you sure?
Yes, we are sure.
You want me to lock C Charlie?
Yes.
Okay, lock C Charlie. Oh! That's the first miss. Took the outside edge and straight to the keeper. All right, all right. Okay, never mind. You still have a lot of margin to play with. Your question number 2 is on your screen. Read it, please.
The second attempt fails again. What should be done now to get an access? A. Attempt peripheral vein access a third time. B. Secure a CVP line access. C. Secure an intraosseous access. D. Focus on chest compressions. Secure IV access at a later time once ROSC is achieved. E. None of the above.
60 seconds on your screen.
Millinated.
$25 seconds. Come on, Kings. 15 seconds. 10 seconds. Kings. 7, hurry up. 5, 4,
क्या करें?
C.
C for Charlie.
Okay, you want me to lock C. Just at the last moment, I think we were closing on to the last second, but they said C Charlie. Was it? And yes, that's the right answer. Well done. You just got it at the last moment. All right, so it seems to be a difficult one for them. The ball is moving around and they're not seeming to be that confident at the moment. Still searching for a clean hit. All right, but you're hanging in there. Okay, question number 3 on your screen, please.
What is the level of evidence of intraosseous access as per AHA guidelines? Number A, class 1, B, class 2A, C, class 2B, D, class 3, and E, none of the above.
60 seconds, start now.
Two
25
B.
seconds.
हाँ.
Which one?
B, हाँ, bravo. B, bravo.
B beta.
Yes.
You want me to lock B beta. Are you sure about it?
Yes.
Okay, then lock B beta. And this time they are sure. Very well done. That's a wonderful strike. Over covers for a 6. Well done. Very well done. And they are excited. They are happy. They are thanking each and everyone and God Almighty for it. Well done. Okay, this seems to be a good match. Let's see where we end up with this. All right. So, question number 4.
After securing IV access, which medication should be administered as a first-line drug as per AHA-ACLS guidelines? A. Epinephrine 1 mg per 10,000 dilution. B. Epinephrine 1 mg 1 to 1,000 dilution. C. Epinephrine 0.5 mg 1 to 10,000 dilution. D. Epinephrine 0.5 mg 1 to 1,000 dilution. E. Amiodarone 300 mg.
And your timer starts now.
That about 10,000, about 1,000.
So that's a slower delivery with a lot of flight. The spinner is at work.
1 mg dilution.
Which way the ball is going to spin? Let's see.
B. Beta.
Are you sure about it?
Yes.
B beta. You want me to lock B beta? Yeah? B beta, right?
Yes, yes.
Okay then. They're very confident this time. They want me to lock B beta. Oh my goodness, they got this wrong. That's the wrong answer. Oh no. 1:1,000. That was wrong. 1:10,000. That was the dilution. Okay. So you have to be watchful, play it carefully. That one was turning fast the other way. Okay. So it's still an open game. It can go either ways, we all know. And that's why this game is so funny and yet so challenging and exciting for all of us. We are moving to question number 5. Read it, please.
After how much time interval should epinephrine be repeated? A. 2 minutes, B. 3 minutes, C. 6 minutes, D. 8 minutes, and E. 10 minutes.
60 seconds on your way.
B. 3 minutes.
You want me to lock B beta?
Yes. 3 minutes. Yes.
Okay, are you sure? Should I lock it?
Yes.
Okay, lock B beta. Oh yes! That's the right answer. He knew it from the outset, got it on the full toss, and that's going over long on for a big 6. Well done, well played, and that was smart, sensible play. Okay, so that takes them to a score of 18. Score to beat is 30. They have to get to 36. Okay, now we are moving to question number 6.
Regarding higher doses epinephrine regimes, which of the following is true? A. There is no improvement in long-term survival. B. High dose epinephrine increases coronary perfusion pressure. C. High dose epinephrine may exacerbate post-ROSC myocardial dysfunction. D. In case of lack of response, high dose epinephrine may be considered as a class 2B indication. And E. All of the above.
Your timer is 60 seconds, starting now. So that's a rising delivery. Let's see how they play it. "25 seconds.
A.
15 seconds.
A for alpha. A alpha.
Okay, A alpha. So you want me to lock A alpha?
Yes.
All right. Lock A alpha. Oh, that's a miss. Oh my goodness, that's a miss. It was a rising delivery and they missed it altogether. Okay. So this is getting more and more interesting now. So they are at 18 now. We just have 4 more questions to go. They have to correctly answer At least 3 of them. Let's see where they end up this time. It's getting closer.
Taking their full time and
Yes.
jumping on the conclusion before
Yes.
they
Ishaq
have
Saab,
60 seconds.
he's watching you, and he's the best advice that is going to come from him is to take your time and make the most of it. Okay, now be very watchful. And Falcons, chin up. You can still win. Stay in the game. Question number 7 on the screen.
The nurse notes that the intraosseous line isn't functioning optimally. As CPR continues, the team leader decided to secure a central line. While the line is being inserted, 5 minutes have elapsed and it's time to administer epinephrine. What should be done? A. Wait till CVP is passed. B. Try to secure a peripheral line again. C. Secure a second intraosseous line. D. Administer epinephrine via EPT. E. Administer epinephrine IM.
60 seconds on the screen.
Little time. नहीं little time. You can सवाल देखो ना nurse notes में intraosseous isn't functioning आपने CPR continues while time is being inserted 5 मिनट लगेंगे उसमें सेंटर में ये नहीं कह रहा कि फिल्टर नहीं हो रही तो 5 मिनट लगेंगे
20 seconds.
जब तक आई मेरे लिहाज से intraosseous कुछ नहीं करा
Approaching 10 seconds. Come on.
5 मिनट लगेंगे
9, 8. Come on. 6.
E.
Are you sure? Option E epsilon. You want me to lock E? But you've said E now and the time's up. So E epsilon. E epsilon. Okay, lock E epsilon. Oh, that's the wrong answer. Even if you had said C, that was going to be the wrong answer as well. All right, all right. It's getting much closer. And that's what we thought. You never know where we go, where we end up with this. Seems like a tight scoring game. But both the teams, you have to keep your heads in it. You can still do it. Although, now there are no margins for error for Kings. You have to get all 3 of them right to proceed to the next stage, that is. Okay, question number 8 on your screen now.
In what dose should the epinephrine be administered via the ETT? A. 1 mg, B. 1.5 mg, C. 2 mg, D. 4 mg, and E. 5 mg.
Okay, the timer starts now. 60 seconds. You can see the tension on both the sides.
कभी दिया नहीं
Oh, he says, I've never given it.
सेम नहीं होगा ज़्यादा orally देना
Okay. "25 seconds, approaching 20 now. 17, 16.
C option, Charlie.
You want me to lock C Charlie?
Yes.
Should I lock it?
Yes.
Okay, then lock C Charlie. And yes, that is the right answer. It was a slog sweep. He didn't know what he was doing, but then he got it over the boundary. Well played, very well done. I think your luck was with you there. And he had never given it. He was pretty honest about it. And even then he got it. So, well done, very well played. So this is getting really exciting now. Okay, and that takes them to a score of 24. They have 2 more questions to go. They correctly answer one of them, it's a tie. They get both of them right. Then the Kings are through to the next stage. Okay. Second last question of the match. Question number 9 on the screen.
After a CPR of 15 minutes, ROSC is achieved. The patient has a feeble carotid with no palpable radial, has a BP of 90 by 60 mm of mercury, and ECG is done that shows anterior STEMI. What should be done next? A. Stabilize the patient medically. B. Activate cath lab and take informed high-risk consent for a high-risk primary PCI. C. Activate the cath lab and rush the patient for primary PCI. D. Administer XK. E. Involve the MS of the hospital and request guidance.
Start the timer.
कंसेंट करना है या कंसेंट देना है एक्टिवेटेड कैथ लैब टेक कंसेंट हाई रिस्क प्राइमरी पीसीआर कंसेंट होगा ही होगा ना रश चेक तो नहीं करेंगे ना विद पीसीआर में कंसेंट तो है ही बी होना चाहिए वर्टिकली तो नहीं करेंगे अच्छा रोज शॉक में है लेकिन मेंटली सही है ना बस अगर बी एक्टिवेटेड कैथ लैब
It's really intense out there. Fighting it out. Can they get the right answer?
Beta.
Okay, so you want me to lock B beta.
Yes.
Okay then. Lock B beta. Oh yes! That's a great answer. They were confused between the two, B and C, I believe. But then in the end, they got the right one. And that's very nicely played. Teamwork coming into play. And with this, now, one question to go. And the scores are level. Are we going to have a tiebreaker? Or are the Kings going to take it? This question is going to decide it. Getting down to the wire. Question number 10. Bring it on.
The patient is taken to the cath lab and is scrubbed. The radial pulse is not palpable. What should be the mode of access for cath of this patient? A. Switch to femoral access. B. Use ultrasound guided transradial access. C. Use right ulnar access. D. Use left radial access. And E. Start CPR.
Timer starts now. 60 seconds. An extremely important question.
A alpha.
You still have 40 seconds. You want me to lock?
Yeah, sure. We'll switch to femoral.
You will switch to femoral. You want me to lock A alpha?
Yes, A lock.
Okay, so this is the decider. You know that.
Yes.
And they want me to lock A alpha. Lock A alpha. And yes, well done. That's a 6. Very well played. They were very sure on this one. And they have played this one. Oh, that's a huge 6. Very well done. I like the confidence. And with this, we have a winner today. And it is the Kings, NICVD Kings from Karachi have taken it, but they've taken it on the last question, on the last ball. What a wonderful match we've had today. And I told you, these low-scoring games can be tough at times. But I also want to mention here that Falcons also played it very well. And if it wasn't for the last couple of blemishes that they had, I tell you, the story could have been different. But we have all taken a lot home. We have learned a lot of things, and I think this is a great learning experience for everyone. With this, I move to the umpire now, Professor Ishaq Saab. Sir, where are you?
Well, thank you very much, Hamza. Another excellent match, and congratulations to NICVD Kings for winning the match with a narrow margin. The scores on both sides are not great, but nevertheless, both the teams ought to be congratulated for the effort they've made. We always say that these matches are not to humiliate a team or to make the other team very glamorous or a legend. But these matches are basically The objective is to increase our learning curves and get a kind of stimulus and a kind of challenge to read more and more and keep ourselves updated with new guidelines and new developments. And clinical medicine should never be forgotten. So the questions were quite good, well set scenarios, and well set on both scenarios. And I think the NICVD Kings had a little have performed better than the other team, but the other team also fought well. And I would like both the teams to keep up with their efforts and keep up with their knowledge-seeking endeavors. And I think there's no limit of knowledge, and there's no limit. We are learning from these interactions and these questions and these answers. Whenever there's a question of figures, 2 milligram, 1 milligram, 3 milligram, I think there it shows their clinical experience and clinical involvement. All those who do clinical work seriously, they remember the doses, they remember these things because they have given themselves. Reading is one thing, and actual practical knowledge is another important thing that has to be there to win these matches. So once again, thank you very much, Hamza, for an excellent moderation. Thanks to Messrs. Wilson Pharmaceuticals, Hamza, for organizing these matches, making a very lively discussion. And both the teams need my compliments. And we are very happy to see that the youngsters are learning a lot. They are giving time to their studies and to their patients and clinical work and research work. So I think this is great effort, great opportunity, and a great exercise that we have weekly basis. And well done, all of you. And my best regards to my fellow umpires and colleagues, Ambar Ashraf, Brigadier Hamid Saab, and all those who are present here, making it a successful event. Thank you very much, Hamza. As ever, it's a pleasure to listen to your moderation and to listen to the youngsters, the way they answer. Thank you.
Thank you very much, sir. The pleasure is always ours. I think it's great to have you, and your words of wisdom are extremely important for our teams and for all of us. And I think it's the wealth of experience that Professor Saab brings, and our faculty also brings a lot of different aspects that are really important for all of us, and especially for our teams to take heed from, take their lessons from, because life is always tough. There are challenges every day out there, and you have to improve every day. And as we all know, that these are real world scenarios. I mean, these are clinical scenarios that you will face during your careers and in your wards and your ERs. And it's always said that your textbook knowledge actually goes hand in hand with your clinical practice, and you have to put them both together with your experience. You have to come up with the goods when they are required. So well done to both the teams. And I think I'm going to move towards Professor Ambar Ashraf. Ma'am, your thoughts today on this game?
Thank you, Hamza. This scenario is really very close to my heart, and it's a wonderful scenario. Why? Because that is advanced cardiac life support, and that's very mandatory topic for all of us. And that's why AHA recommendation to recertify every 2 years, because most of the time in day we are not practicing these things on each and every patient. Salute to NICVD team, they played very well. Take home messages, please kindly go and study these ACLS protocols. That's a very mandatory, it's life-saving. It's not mandatory for the intervention cardiologist, electrophysiologist, but that is for the sake of a layman, the nurses, the healthcare professionals, all the medical professionals, in order to save the human life. I love that scenario. Who has organized that? Salute to them. But that is the need of the day, and what Professor Isaac has highlighted: the practical and practical work. No match to that thing, and that's always rewarding. Congratulations, and Hamza, we always enjoy your moderation. Keep it up, and thanks to Wilson's who has organizing this platform to all of us. Thank you very much.
Thank you very much, ma'am, for your kind words, and we always enjoy your presence and your comments. I think they're pretty spot on, pretty accurate, and you've rightly put it in words. I think it's extremely important for all of us, and especially these ACLS practices. You have to stay current and abreast with the recent advancements. Every 2 years you have something new coming in, and thanks to all the research which goes into it, we're learning new things, we're learning new techniques, and the approaches change. So initially we used to have ABC, now we have circulation, before that it's CAB, and even the timings, they keep changing, how you have to approach your patients. So there's a lot of work that goes into it, and if we are current, then I think we've got a better chance of saving our patients, because they'll hardly give you a few seconds. So it's that's where it's important. So do we have our other faculty members? I think Professor Fawad Farooq was there. He's not there anymore. So can I have the two teams there? Are they still there, the two teams?
Yes, yes.
Okay. So our Falcons are there as well? Okay, Falcons.
Yes.
So just a quick word. How do you feel? You've done really well today.
So it was a nice session, and best of luck to the other team for future.
Okay, so I think we all enjoyed you as a team. You've done very well. You looked very confident on occasions, but you see, you win some, you lose some. But today I think everybody is winning, and I must congratulate you for your effort. Very well done. Brilliant work. And best of luck. So Kings, where are you? Your thoughts?
Yes. It was a team effort, but the questions we thought were like, we usually do practice daily, but we didn't consider that this kind of questions can come, like dilution and ACLS.
Yes.
We were like practicing ACS, heart failure, valvular diseases, right? But
So I think
these
you
were like-
must.
These were the basics.
Yes.
These were the basics, but we never thought that this can come. So fine, but hope it was good that we won.
Yeah.
Inshallah.
So well done. You have done very well. You played well. But as you've said, you never thought these kind of questions can come. But this is real time. This is what happens when you're seeing your patients. And I think you must thank all those people who are involved into making these questions, because this is now where you realize how important these questions are, and knowing the theory, knowing the current guidelines, and bringing them into practice becomes so important. So I must say it's congratulations to the Kings, but at the same time I must say congratulations to our LUMHS Falcons. You both did very well, but we all know that one team moves on, the other one at that point in time on that very day doesn't move forward. But life is always going to give you more chances, and you will find your days. So best of luck to both the teams. Very well done. And with this, now we are going to come to the end of this match, and very soon we'll be having you over for the next match. And till then, it's Allah Hafiz and Khuda Hafiz from my end. Take care of yourselves. Allah Hafiz.